Unicef, in partnership with the federal government, Canadian government, River State government, and IHS Towers, has handed over a 720,000 liters capacity oxygen plant to the River State government located at Eleme General Hospital. The plant is intended to enhance maternal, newborns, and child health services in the state by enhancing a consistent supply of life-saving medical oxygen. UNICEF country representatives Ms. Christiane Mohundet emphasized the plant's importance in improving healthcare outcome and reducing reliance on external oxygen supplies. Governor Siminala Yufobara assured that the facility would be well utilized, aligned with the state health policy. He noted that the state investment in healthcare attracted his project and urged the local communities to safeguard it. The State Health Commissioner, Dr. Adeze Ora, added that the facility can produce 123 oxygen cylinders and 720,000 liters of oxygen daily. First of all, congratulations to River State citizens. And all thanks to all the people, the Canadians and the HIS that has
and UNICEF
that are collaborating to make this possible. But this is at Eleme. For them to do this, I suppose it's supposed to be for free. But I mean, what happened if we eventually realize that people have started paying for this? And again, anyways, that's a by the way question.
Yeah.
Now, looking at these new developments, we know that we have this just in the General Hospital at Eleme. That is to say that it is certain. There are some hospitals you go to, they will tell you that the oxygen is not sufficient enough for the number of patients that they have. But here, it means that we are certain that anytime you go there from this period of time, that there would definitely be oxygen for these children, the newborns, the maternals, and all of that. Do you think this is enough for Rivers people? Yes, we know it's a new development, but a lot of persons want to go there. What do you think about this?
Okay. Like you said, let me digress by saying, like you said, congratulations to Rivers people.
Yeah.
You know, where the Bible would say that where there is a casting down, there is a lifting up. We are going through a tough time, a period of recession and difficulties, and all of a sudden we are seeing this. It's good news. It's good news. So I join you, Emma, to tell Rivers State Executive Governor, Dr. Sim Fubara, congratulations. Congratulations to Rivers people. And congratulations to Elemetu as the host community, even though it is not for them, it is cited within them, but they have a responsibility. Yes, but they have a responsibility, because part of what the UNICEF country coordinator mentioned is maintenance. It's a massive facility, a facility that will produce 720 liters of oxygen daily. It's massive, but do we have maintenance culture? Will this woman, with the country coordinator of UNICEF, will she come back in 2 months' time and we don't find one equipment broken down? This one is not working again. There was power surge, so this one burnt. Those are the problems I will have in my heart. And as I speak the minds of millions of Nigeria, I suppose, that the concern will be how to maintain this facility. In other climes, you can come back 10 years, it's still running. Here in Nigeria, you come back 10 months, and it's no more working. Some thieves came in the night, some marauders came, they pulled out a cable. All those narratives, we should end them.
All those narratives, we should end them, according to you. So why can't we also end the narrative of always having in mind, whenever there is a new invention, a new technology invented, that Nigerians cannot maintain it? So why can't we be optimistic that, okay, this one has come to stay, the people will be able to take care of this? Why are we always having a mindset of how are we not sure that this thing will break down? How are we not sure that this thing will not work? Is it every time? Is it that Nigerians are so careless or what?
The thing is, you see, those of us in social studies and human-related subjects, we don't just make these statements. It's because it's over time. This is Nigeria. We are going to be 64 by October, and that has been our history. That's why we ended by saying, let's change the narrative. As for the past, it's already there. The evidences are there. Everything has broken down. So,
are you saying that there is nothing in Nigeria that was invented or imported that has been in existence till now? Are you trying to say that nothing lasts for 2 weeks, 2 months, or a year?
I don't know why you're asking me.
Yes, I have to ask because you are the way you are going about it is as if maybe Nigerians do not know how to maintain anything at all.
I wouldn't want, or see, I wouldn't want us to go memory lane. Otherwise, that would take the whole day. But I will just give you an example. What is Nigeria Airways? So leave those things. We don't maintain. That's the issue. But it's our prayer that this one will last.
Just Nigerian Airways. So because that was not maintained, it means that other things are not being maintained. Okay, now that you have cited, you have given me example of the one that Nigerians could maintain.
Do you want me to go that?
What about the ones that Nigerians were able to maintain?
See, my worry, we're not going, the purpose of this program now is not to go and list the things Nigerians are not doing well. Because if we want to do that, we'll have a lot to list. I'm only saying this one should not be part of the statistics. Because we already have. And I'm not the one who is going to speak. The evidence is there.
All right. And now, looking at the fact that this particular cylinder can produce about 120,000, I mean, 720,000 liters of oxygen daily. And we also know the capacity of the hospital, the general hospital. So don't you think that because of this, that the place is going to be congested? Because this is almost a free medical, this is donation. This is almost a free treatment here. So don't you think the place is going to be congested? And what is the governor of the state planning to do to enlarge or not? Because of course you know that Eleme is not very far.
They didn't give us further details. But you see, when you have a plant, people come there to collect and then go and use at the facility where a patient is. It's not that all patients who need oxygen will come to Eleme, but that it will be a plant.
Okay.
So if I have a hospital in Omok, I have a hospital in Degema, I have a hospital at Abonima, I drive down with our ambulance or our vehicle, official vehicle, I sign out because it's an office.
Okay.
They will create an office where people come. There is a storage. That's what I'm thinking, because when you talk of plants, all these things are involved. Then, because when you look at petroleum depot and you use that to juxtapose, you know that there's going to be a place where they manufacture, where they preserve, where they keep, and then people go and collect officially. If it is to pay a little, I don't know what they have in mind, whether it's totally free or subsidized. They pay, they collect their consignment and go and attach to the patients in their various facilities, various health facilities. But the plant in Eleme becomes the production center.
So that's to say, I mean, is this to say that the era of expensive administration of oxygen in River State has gone?
We may not say that for one reason. For the first reason is what you said. We are just starting. It has just been newly commissioned. We are going to wait to see how it will be effectively operated. That has been part of the prayer.
Okay.
That's number one. Then number two, it will depend on the number of patients. Because if you have like 2 million patients needing oxygen a day and you have 720 liters, then we are going to run a shortfall. So it appears from here we will not despise the day of little beginnings. Like the Bible will say, from here, we're expecting that there will be an expansion. One of the things I want to add is that Nigerians should not sit back and say, well, Canadian government, Unicef, they have given us something, so we stop there. You can increase it in the next 1 year from 720, double it, or whatever, so that the capacity increase, and then you can open another place. It can be in Abonima. If you look at the map of River State and you feel that Eleme is this way, you can open Degema this way, or Abua this way, or Omok this way, so that accessibility is enhanced. But like I keep saying, who knows?
Okay, well, this is just something that has just started. So we would not stop saying congratulations, and again, we hope that the people will utilize this and manage it effectively. All right, and then this next one is from FCT.